Thank you, Paul. What might it all mean for our health service, farmers and local businesses? With me are Matt Griffiths from Business West, that's an organisation which looks after companies and represents them. James Small from the National Farmers Union, he's a farmer himself. And in our London studio is Dr. Layla McCay from the NHS Confederation, which represents organisations across the health service. Thank you all for coming. A happy new year. Now, this deal has got to be approved, hasn't it, by our Parliament, which it will be, and the EU Parliament, so perhaps there's some uncertainty about that. So let's start with you, if we could Dr. McCay. I mean, has the NHS now stopped planning for a no-deal Brexit in a few weeks' time?
My understanding is that it's now very unlikely, so that planning has been reduced. I think that we still need to be prepared for everything, just in case, but it is quite likely that no-deal Brexit is a much smaller risk than it was before.
Right, so if the deal is approved, will anything change as far as the NHS is concerned on February the 1st?
The point of the transition period is that during the transition period, things will feel pretty similar. And it's during that transition period that everything has to be discussed and negotiated. So all the things that we were worried about in a no-deal Brexit, because they were immediately going to stop, things like the smoothness of bringing medicines and medical devices in and out of the country, things like getting healthcare if you happen to be in the EU as a British citizen, access to research, access to these really key alert systems for international health threats. We will still have all of that until the end of the year, and what the negotiating period now is going to do is figure out what's going to happen after that.
OK, so after Brexit, is it likely that EU nationals living here in the West Country will still get free treatment on the NHS, and those of us who perhaps go to live or to work in Europe will also get free health care?
Assuming that the deal passes, then that will be the case until the transition period finishes. The transition period, of course, is currently set to be at the end of the year. What happens after that will depend on what happens during the negotiations in the next few months. OK, no one knows, do they? James Small from the National Farmers Union. Many farmers voted for Brexit, didn't they? May I ask, did you?
I did, yes.
OK, so that you've now got what you wanted. How will farmers' lives change, do you think?
Well, what we're principally seeing is that the control of agricultural policy comes back to the UK. So there is an agricultural bill which was being brought forward before Christmas, but it got lost in the myriad of the shenanigans at Parliament. We're expecting that to come forward again, and we look forward to actually seeing food and farming being included in the agricultural bill, which seems to be a bit light to start with.
How will lives change for West Country farmers?
Well, as your previous speakers, for the first year, there won't be much change. We're going to carry on as is. What we're then going to see is a change in the systems that will be in place. And what we're looking at is that we want to be able to supply British produce to the British consumers. We want to be able to see a strengthening of the grocery code adjudicator to ensure that consumers are able to make free and clear choices. And the real key to this is going to be what future trade deals are done to ensure that the goods we produce here are not being undercut by goods that are imported that simply we wouldn't be allowed to produce here.
I guess, but West Country farmers, if they want to export into the EU, will have to comply with certain standards. But what about food that might come in, say, from America to here?
Well, absolutely. We have some world-leading standards here when it comes to food production, and we're really keen to maintain these. And the government has said that there will be no undercutting of our standards. Now, that's good. But what we don't want to see is goods being imported via a trade deal that are produced to standards that would simply be illegal here. All that is going to do is exploit our environmental conscience. We don't want to see that. We have a great record here. We can do more. We can work more with the environment when it comes to climate change, sustainable sourcing of food, everything we can do here.
Do you any regrets about voting for Brexit instantly, or was it the right thing?
The reason why I voted for it is still the right thing. Nothing's changed in that.
OK. But Matt, one thing that the NHS will need, as we heard from the doctor, and the farmers will need, is labour.
Yeah.
Now, what are your concerns about that, or your hopes?
So, we saw a white paper on migration last year, which puts forward some proposals about what the future migration regime would look like. We were concerned that they were quite restrictive, and we did a study, which you covered, in fact, which said that if you looked at the current EU workers within the West of England, Bristol area, if they were to reapply, 75% wouldn't be eligible to come back if they were reapplying. So we're concerned it's got quite a high salary threshold of 30,000, but also the requirements for skills and qualifications is quite high.
I'm not sure that it's £30,000 now. Is it? I thought that had been done away with.
Exactly. So that was in the initial white paper,
yeah.
but there's going to be a really active debate over the next 6 months beyond
farmers
that.
need labour as well, don't they? Particularly in
Again, it's another piece of legislation coming forward, the immigration bill. We absolutely need access to a skilled workforce on farms up across the country, certainly in this region. So it's really important that we're able to have access to that labour from wherever they come from in the world.
OK, let's go back to Dr McCay in London. Are there any signs that the number of people coming to work in the health service from the EU are falling away?
I think there are concerns about that, yes. I think everybody is really looking to see what the new system is going to look like. But in the case of health, it's not just health that is worrying, it's actually also the social care system. So if we have high salary caps, that might be okay for some of the more senior health workers, but really where we really need people is some of the more, the less well paid health workers and also people from within the social care system. And we want to make sure that whenever we come up with the solution to this immigration question, it's something that really works for our needs.
All right, well, we will come back to this many times, I'm sure. For now, thank you all very much indeed.